Hello everybody, welcome back to Menopause, your management, your way, now and for the rest of your life. And I'm bringing you professionals who know things that I don't know. So today you've seen Dr. Singh before and you're going to see her again because Dr. Singh has so many talents and so many professional accolades that she serves many purposes. Thank you, Dr. Singh, for being here.
Thank you.
We've seen you on another occasion, and that's because you have so many different things that you can do for menopausal women. And last time we interviewed you because you are an herbalist, and this time we're interviewing you because you are an acupuncturist.
Right, and today we'll talk about needles.
Needles. Everyone loves needles.
Everyone.
So tell us, for those people who don't know, what exactly is acupuncture from a procedural standpoint?
Well, acupuncture is a form of medicine which has been around for thousands of years and basically utilizes the meridian, the energy that is flowing through our body. So, for example, here we have each of those lines depicts an energy meridian or a channel, and which would be responsible for a certain organ. And with the acupuncture needles, we establish the flow of energy in those meridians to be able to bring about balance.
Okay.
So it's as simple as that.
Okay.
But these small little needles can do anything from pain relief to relief from to help the patient sleep better or help with the hot flashes, headaches, migraines, you name it.
And are there different kinds of needles for different points on the body or for different things that you're trying to accomplish?
Sure. The needles, we can take a look at these.
Yeah.
These are really teeny tiny. They are...
Teeny little, teeny weeny things. Those are needles of all things.
And they vary, as you asked, Doc, in size. There's some smaller, some larger.
Yeah.
And
longer and shorter, right? Okay.
Longer, shorter, and they are really thin, so we can open one of these to show you how they look.
Yeah, that is,
So when you look
this
at
is
that,
smaller than like a sewing needle.
and when you look at that needle, it sort of definitely, nobody, like we talk, nobody likes needles. So when you're thinking of needles, you're thinking of these blood drawing or injection shots that you've had, but these don't have a lumen in them. There's nothing. They're just fully formed, really flexible, thin needles. And when we insert these, you basically may feel just a little pinprick at times on certain points, depending on anatomically where they are in sensitive areas, being that the inside surface of the arm is more sensitive than the outside with the nerve endings or the palm or the soles. And some points you don't feel at all. And these are one-time use. We dispose them after we are done. There are others that are little retaining needles. So these ones are on a little sticky like this. And you barely see the needle there.
Oh, there is a needle there. Oh, wow. That is tiny, tiny. Look at that. Okay.
And these are retaining needles. So they just stick on the skin like that. And the needle pierces in. And these are used a lot for auricular or ear acupuncture. Now the fun part with these retaining needles is that we can leave them in for a couple of days.
It looks like you could leave them in and just forget it was there.
Definitely. We don't want them to forget that they're there, but they can be left in for anywhere from about 4 to 5 days.
Wow.
We in our clinic use these a lot for auricular or ear acupuncture.
I'm gonna hold this up because you just can't even believe how small this thing is. Look at that. That is so tiny. It's almost, oh gosh, it's half the size of a little round Band-Aid. And it has a little tiny needle coming out of the middle of it. Wow.
Right, and the patients can keep these in, and these we use at the clinic a lot for auricular or ear acupuncture. Now the ear has a microsystem of acupuncture points which represents different body organs or areas, so you can find a corresponding point for knee pain or ankle pain in your ear and leave the needle in there.
It's amazing.
So
now with these needles, do you transmit something through them? Does electricity go through them, or are they magnetic? Is there heat? I mean, does anything happen?
These
with
are
the
plain
needle?
steel needles.
Uh-huh.
There are different procedures where one could put what is called moxa, which is an herb that is rolled into a little stick that you can stick on top when you're trying to warm it.
Okay.
That can be lit up.
Okay.
So that can be done, but otherwise they're plain
They're just
stainless
plain, okay.
steel needles. There is nothing on those ones that we don't inject anything with them or apply anything on them. In fact, we clean the area before for what is called the clean needle technique, so that they are there's no harm with those needles.
Yeah.
We do have a TENS unit which is called electroacupuncture that we'd utilize for,
Okay.
and then we hook up
Yeah.
the little clips onto the
Yeah,
needles.
Yeah, so
and
that would be an electric current going through
correct,
them.
and
Okay.
that's the one that you were asking about, the electric
Yeah,
current,
yeah.
and that helps to intensify the treatment.
Okay.
And the electroacupuncture has its place in different kind of things where you're trying to stimulate or you're trying to help pain relief or intensify the
So
treatment.
you choose what you want to do with the needles based on the patient and the symptoms and the severity of symptoms. So everything is geared
That's
for
right.
the situation.
Right, so
Very
it's more
interesting.
individual about who's requiring what treatment at a certain time.
Yeah.
So they
yeah.
may be having more issues with some sciatic pain along with their menopausal symptoms, and
Yeah.
that may be something that's bothering them more than the hot flashes that
Sure.
day, and we might choose
Sure.
points based on
Yeah.
what the presenting complaint is.
That's great. Do you tell patients a lot about the history of acupuncture, or do they seem to know?
We do
that
most of our patients do their homework.
They do their homework.
Most of them have, and thanks to the websites and information out there,
Yeah.
most of them have done their homework, looked at some of the studies we have there, some of the
Yeah.
information background, but it's always very
That's
fascinating.
great. That's great. Now, are there specific kinds of medical problems that acupuncture is best for, or can acupuncture be used for just about anything?
I would say, in my experience, almost anything. But exceptions are to the rule for
Yeah.
everything, and so definitely not something recommended in emergency situations.
Yeah.
Not something that is recommended for pain that hasn't been the patient hasn't had a consult
An
with their medical
evaluation.
doctor or
I see.
evaluation as to why they're having it.
Yeah.
So almost in terms of, to answer your question about that, yes, for pain a lot,
Yeah.
for de-stress, for the common things we see in the clinic setting are headaches, back pain. We do a lot of women's health, so there's a lot of fertility related. Then, of course, as we're talking about menopause, the menopause related.
Yeah.
And the menopause related complaints that we can address with acupuncture are the hot flashes, the night sweats, the fatigue, the
Okay.
depression,
Yeah.
and just numerous things that
Yeah.
can come about with the menopause,
That's
depending.
great. That's great. And are all people good candidates for acupuncture, or do you sometimes find someone who just isn't a good patient for acupuncture purposes?
I think all patients,
Anybody
can.
Okay.
With some of our elderly patients, we may
Yeah.
use fewer needles, we may use
Okay.
the shorter ones, so it just
Yeah.
depends on how much, and that selection is based on what sort of energy the patient has to begin with.
Really?
Because you cannot do something too strong a treatment.
Yeah.
Similar as in Western medicine when we
Yeah.
pick the amount of medication
Sure.
based on the body weight.
Sure. Okay.
Similar.
That makes sense. And are there any risks?
No.
I wouldn't
In
think
the
so.
right in the right hands, there aren't any risks with the acupuncture, and like I mentioned about the clean needle technique, because you're making sure that you're doing a clean procedure.
Yeah.
You're being careful about anatomically what other organs. So there's no side effects of
great.
it. One of the side effects would be a good de-stressing when you're there.
That's a good side
A
effect.
beneficial side effect. Yes.
It's a wonderful side effect. We'll take it.
All right, right.
And if you have a patient who undergoes acupuncture and the acupuncture doesn't work, what's usually the next step? where do you go from there? Do you usually then refer them back to a medical doctor, or do you then pursue it some other way, maybe with your herbs or something? What's typical?
That's a great question. So if you will not expect 100% of a result with each and every patient, and again that would depend on individual patients,
And
but
what their goals are.
Their goals, as well as being a gradual, more natural process. Sometimes it takes a couple of weeks to even see a difference. So we do have that conversation at the consultation time to say, will this situation or complaint take 4 weeks or 5 weeks? And once they've tried it and on a regroup there have been no changes, then as you said, one could add herbs, herbal formulas, or one could have them go back to their doctor and reevaluate, and so may have to refer them back to the medical doctor.
Would you say that a vast majority of your acupuncture patients are menopausal women? Is it a majority of your female patients, or would you say it's half or 20%?
I would say more like 1/3 of what I say, because
that's what I guessed.
Mostly, like I said, it's a lot of the fertility patients and gynecology issues, but I'm seeing fertility patients that I saw 13, 14 years ago who were trying to have children, and then
so you got them pregnant.
We got them pregnant. They had the babies, and now it's time for that next physiological step.
They need you for everything. That's good. And would you say hot flashes are the very most common symptom?
Yes, that's something that will mostly bring the patients in, would be the annoying hot flashes. Yes.
And when you do an acupuncture treatment, how long does that result last? I mean, is this something where a patient comes in every week or so, or
that's what's usually we recommend weekly. And another good way to gauge is according to their subjectively what improvement they are seeing. Say somebody comes in for the hot flashes and says, I was better for 3-4 days, and they started to come back. So in those patients, if we may even initially try to do twice a week at times, if that works with their timing, just because their bodies are telling them how long they're better with it.
How does that, I'm trying to think physiologically how the time frame that the treatment works corresponds with the meridians. What is the logic with
for how
long acupuncture treatments
last?
Work or last?
That would be dependent on the conditions. So if there's an acute pain situation where someone comes in with a frozen shoulder or tennis elbow and it's acute, there'd be a faster improvement on it. Because, and for something chronic, if I see somebody who's had back pain for 5 years or 6 years, I would not expect results in 2 or 3 weeks or 4 weeks. It would take longer.
That's interesting. And a typical acupuncture treatment, if they're coming in every week, how long is a typical treatment?
A typical treatment is about half an hour.
Okay. Yeah. And they have a series. And if you have, let's say, hot flashes, do you tell the patient you will probably expect to have 6 weeks of this, or do they just do it forever? I mean, it's like a package.
We would start with them for about 4 to 6 weeks and see what sort of results. And as we know, those hot flashes may go away and may come back again. So they may have relief from them and then be free from all those symptoms for about 2-3 months and may get them again. So they could be lucky and just kind of not have them at all. It varies with the. That's exactly right. To wait and see, and initially give it about 3 to 4 weeks or 5 weeks to see if that would help, and go from there.
That's interesting. And would you say that the majority of patients get a result pretty quickly? Do they see what's going to happen, or what kind of a result they're going to get pretty rapidly?
Pretty quickly. The pretty quick in acupuncture would be 3 to 4 weeks.
Right.
So you may notice a difference right away after the first treatment. Some patients who come in with insomnia, they may be like, that's the best night sleep, all night sleep I had in 5 years or 3 years. So that can happen.
And does it erase the problem or just make it less bothersome? Is it just a matter of degree?
It's to a certain extent, because what we have talked about with menopause being more of a change, which is a natural change.
Of course.
So there's no reversals.
Yeah.
There's only an easier management of the symptoms.
Okay.
And they could totally sleep well forever, or they could be able to have some intervals where they wake up, but they find it easy to go back to sleep.
Yeah.
So it again is
and
very individualistic according to how they respond.
Yeah, it seems like it. And you can use acupuncture with just about anything, right? I mean, there's nothing that is contraindicated about acupuncture as far as I know.
No contraindications.
So you could say go to your family practitioner and also have acupuncture for your arthritis or something, or you could go to your gynecologic menopause specialist and also have acupuncture for insomnia or other symptoms of menopause. You can double up, basically.
Right.
Pretty cool.
Right.
And there's no harm. I mean, there's nothing to lose, right?
That's right. In fact,
that's the cool thing, I think.
That's what something that is amazing with this system of medicine, that there's no side effects.
Yeah. And do you typically, with your menopausal patients, use more acupuncture alone, or do you tend to find that you use the acupuncture along with some herbal therapies?
Usually I gravitate towards using both acupuncture and herbs, because as we talked about those annoying hot flashes, when they're really getting in their way of life and being able to function, well, they need to take whatever they can that would help them in a more stronger sort of a way of combining the herbs along with the acupuncture.
Okay, and since you do both herbs and acupuncture, I can ask you a question that I don't like to, do the better, worse, good, bad, right, or wrong thing, but which do you think works better for the typical menopausal symptoms of hot flashes, night sweats, insomnia, mood swings? Would you say the herbs tend to work better, or the acupuncture tends to work better? Or is it just 50-50 and it depends on the person?
I would take C as an answer.
Really?
It would actually, they both combined would be the most helpful, the most beneficial, and then again, it depends on how the patient responds.
And do most people want to start together with both of them, or do you find that more people want to try one and then the other and add them and see what how do
a lot of people might want to start with one thing, especially if it's something that they've not been exposed to in the past. So if they've had acupuncture before and they're comfortable with it, then they're like, yes, bring it on, the acupuncture as well as the needles.
Bring it on.
But if they are first time exposed to doing either acupuncture or herbs, then they may be tentative about starting both and say, let's start with one. And that's perfectly fine doing that.
So the acupuncture doesn't hurt, really doesn't hurt?
It doesn't hurt. If anything, you feel some of the needles as the smallest of like a mosquito bite, and then it's over.
Okay, you want to stick a needle in my hand?
I sure could try that.
Sure want to?
I sure could try that.
I sure do. As long as you didn't say I want to stick it in your eye or something. Okay,
there are points around the eye too.
No, let's not do that.
Okay, since you want to try that, we can definitely do a needle for you.
I'm very veiny, so you have to kind of dodge all the veins. I have a lot of veins in my hand. Look at that.
So we can find an area where it would be less of veins. So here we have. Here we go.
Oh, see, that's absolutely painless. Absolutely painless.
In a detailed consultation, the diagnostics from looking at the tongue and the pulse, then we proceed to do the acupuncture treatment. And here's a demo to show you how we insert the needles. Needles stay in about 30 minutes or so. And I'm just going to demonstrate a few of them for you to take a look at how it feels. So swab the areas that we need to do the needles on, and they're pre-sterilized, pre-packed. That's sometimes a question with patients, are they reusable? No, they're not at all. And as easy as, here we go. So there's a needle, and our patients laying comfortably. Or we could do another one right here if you want to look. So as moving forward, we might choose points on both sides, and this is dependent on what we are working on at that particular time. Are we working mostly with sleep issues? Are we doing mostly hot flashes? There's points on the legs that can be demonstrated here. So there we go. And once the needles are in place, like I said, about 30 minutes that the patient's able to relax comfortably.
I think what you do is fascinating, and of course I think it's wonderful, because I think anything that you can do for women, especially menopausal women, is fantastic.
Thank you.
Thank you so much for helping so many women. Ladies, acupuncture, it's a great option, and people like Dr. Singh are out there to help you. So you can check into it on your own, and there is a link for Dr. Singh's Eastern Harmony Clinic, and see what you think. That's it for today. I want you to be sure to follow me on Facebook and Instagram and Twitter, and come back and see me in a week. Bye!
Thank you. Bye.